Welcome to today's webinar. The topic for today is the role of indoor air quality technology beyond COVID-19. My name is Megan Klein and I will facilitate our meeting. If you have questions during today's presentation, simply use the Submit a Question button to get them over to our team. We will answer as many questions as we can at the end of this presentation, but if we don't get to your question during that time, we will be sure to respond by email. Our goal today is to spend the next 45 minutes together diving into this important conversation around air quality. A special hello to the members of the Wisconsin Assisted Living Association, and a giant thank you to everyone who is joining us today. Please note, the information contained in this presentation is intended to provide general information but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting qualified legal counsel. This webinar will be recorded. Today's webinar will be presented by John Walter and Zane Davis. Zane joined Direct Supply in 2019 and is currently a business strategy manager, developing and launching new solutions for Direct Supply's customers, focused on solutions that make buildings as safe as possible for residents and staff. Zane studied economics and studio art at Indiana University, returning a decade later for his master's in business administration. John Walter joined Direct Supply in October of 2008 as the first participant in our company's postgraduate management training program. He now serves as the Executive Vice President and General Manager of TELS. John earned a Bachelor's of Science degree in Economics and Corporate Strategy from Vanderbilt University. He then graduated with honors from Indiana University's Kelley School of Business, with an MBA focused on entrepreneurship and corporate innovation. However, his greatest education may have been waiting tables at a skilled nursing facility in Elkhart, Indiana, when he was just 16 years old. And now, please welcome John and Zane.
Thanks, Megan. Welcome, everyone. We hope to be both brief and useful in today's session. And we're so thrilled because so many of you have joined us. And I think it really speaks to the importance of today's topic. But before we get rolling, we just really want to salute the agility and the compassion that you've all demonstrated over the last 18 months or so. It's really extraordinary what's happened in our profession. As devastating as the pandemic was and has been in our profession, we're in awe of the compassion and the professionalism and the heroism displayed by all of you, our customers. And so it truly is an honor here at Direct Supply to serve you and to serve with you. Now we're all searching for productive ways to build better and safer environments. And today's topic is really all about pandemic preparedness in a post-COVID world. We're proud of the progress that our entire profession has made on the COVID front, and we certainly have a long way to go. But really, we have to think about what is the role of infection prevention in the future. And the plus side, as we talk about today's investments, is that what's best for safety is, in fact, best for census. And we all know that the census situation is pretty dire right now, and we're seeing an uptick, but we have a lot of progress that we need to make. So let's ground ourselves in the data just a bit. Just last week, we saw in skilled nursing about a 30 basis point boost up to a 14.5% decline using February 1st, 2020 as a baseline. So that's industry-wide, right? So we're still down 14.5% from a February 1st, 2020 baseline. On the assisted living side, skosh better, we're down 12.2% from a February 1st, 2020 baseline. Our hope is that by really placing a lot of focus and energy behind safety initiatives and indoor air quality, we can demonstrate to our residents and our prospective residents that these buildings that we operate are in fact the safest places for older adults. And that's why we're so excited about today's content. So real quickly, let's just look at our agenda for how we're going to structure our time. Like I said, we want it to be both brief and useful. We're going to talk a little bit about the importance of indoor air quality in senior living. We'll get into best practices that we should implement. Just a side note, obviously we all understand that every building and environment is different. And in fact, geography matters a lot too, because indoor air quality is hard to talk about without the context of environmental air quality. And so we just have to keep that in mind, that every building does need a unique plan specified to the needs of that structure and to where the building resides. And then lastly, we do want to talk about driving census with safety and air quality initiatives, because we do believe that safety equals census. And in order to be able to invest appropriately in the technologies we need for the future, it's important that our residents come back and we're able to drive census as well. So moving forward, next slide, please. Poor indoor air quality has been plaguing senior living forever, for decades. And the reason this is a challenge is because in senior living, we care for a lot of compromised immune systems. So it's no surprise that anyone on this call, 388,000 residents die each year due to infections in long-term care facilities. And our primary tools have been disinfecting, hand hygiene, protection against larger droplets, right? The genesis of the 6 feet of social distance rule. And thanks to all the research being done over the last year and what we've learned from COVID, some of that theory is evolving quite a bit, thanks to access to reams of data. And we now know that aerosolized particles play a significant role in the spread of disease. And it's up to us to leverage that learning to address those aerosolized particles in the air and figure out how can we knock that 388,000 number way down, reduce infections, and enhance the health of all the residents we serve. So all those infections end up costing our profession a lot of money annually. You know, over $2 billion are the cost of these healthcare acquired infections. And so the preventive measures that we can put in place can have a measurable impact on both the quality of care and the cost of care. And that's why you all logged in today. But here's the scary part. As we get into our indoor air quality content, 81% of long-term care facilities have inadequate filtration and ventilation. Even the most modern portfolios of buildings simply weren't designed with optimal ventilation in mind. And our profession paid the price for that in 2020. And so it really speaks to the infrastructure modernization that we need in order to brace our entire profession for subsequent coronaviruses and figure out how to take infection control seriously in new ways, adding this new knowledge and new technology into the mix. So we have a little bit of help. We are seeing momentum for indoor air quality in the Biden infrastructure modernization agenda. And Direct Supply continues to fight the good fight on Capitol Hill to make sure that senior living is a beneficiary of all the funds being deployed. We'll talk a little bit about that later in today's call, because we do hope that our enlightenment as a profession in terms of the role that indoor air quality plays in quality care will translate into hopefully government officials feeling the same way and letting both regulation and funding follow suit. So moving on to the next slide, it's always nice to have our residents do the talking, right? And so Direct Supply, in collaboration with a group called the Developers Collective, people who are looking at investing into the future of senior living, conducted a survey. This survey had 1,000 seniors and 1,000 adult caregivers to try to figure out what did the future of senior living need to look like. And here's the headline. 71% of seniors say that demonstrated safety would help address their concerns about senior living. The question that we asked was, what could senior housing do to make you feel more comfortable about your concerns or any other services being offered? And as you can see in the pie charts here, more than 2/3 of seniors want to know they're being protected. 65% of the adult caregivers felt the exact same way. So what's this tell us? It tells us it's not just enough to be safe. You have to help residents feel safe, and they have to see. They have to see the safety. We have to make it come to life for them. And that's a challenge with indoor air quality because you can't touch and feel it. And so the onus is on us as a profession to figure out how to make the right investments, but also make it clear to the people who consume that air that it is in fact safe to be breathing it. So moving on, from the same survey, we got another really important insight that when we asked the question, what types of technology would influence your decision-making process, right? The same respondents said that infection control technology was the primary driver of their decision. So you see on the very last side, the overwhelming majority of respondents, of seniors, said that infection control technology was where they wanted to see investment and how they would make decisions on where to live. So as we talk about safety equaling census, this is really important to keep in mind that we have to invest in the right technology that makes a material impact on the safety of the residents and then make it clear to them. So moving forward, we are facing an indoor air quality crisis in senior living. I would say that 81% number is the thing we all have to keep in mind. If 81% of buildings have inadequate ventilation and filtration, we must do something about it. And these images on the screen right now capture a significant component to the COVID pandemic in senior living, because these aerosolized particles, very tiny, just a few microns, can remain suspended for hours, just waiting to be inhaled by compromised lungs. So where do senior living residents spend their time? Inside, right? The majority of their time is inside. And this population of older Americans that we all serve, they have chronic conditions, breathing this air inside. And so we have to figure out what to do next. So the rest of today's content is about what to do next and why. And so I will turn it over to Zane.
Hey, everyone. So John just described what can be in the air, namely pathogens. So let's think of those as contaminants. So contaminants are anything that can be in the air. And then you can see on the slide here part of why this has mattered so much for the spread of pathogens, and especially COVID-19 this past year. So a lot of influenza particulate is airborne. There's a study that shows that a fair bit of the influenza virus that's infectious in a building is in the air. And then there's been really good research on COVID over the course of the past years. We've tried to better understand how it's spreading. And some studies show that it can survive in the air for up to 16 hours, and it can survive in the air for up to 15 feet while still being infectious. The reason this is so important, those photos that we saw just a second ago, those nasty photos of sneezes, those are examples of sneezing, coughing, even talking. There's an example from a choir practice, so activities like singing, shouting. All of that is putting contaminants into the air. If those contaminants have to be pathogens, like SARS-CoV-2, which causes COVID-19, that's when it becomes a really big deal. So as more of the virus in the air accumulates, that makes it more likely that someone could then inhale it and become infected themselves. So I'm going to walk through why all of this matters and some of the things that we can do in response to that, and we'll get into a lot of the best practices around this. So think of indoor air quality at a high level as three things. You're trying to keep bad things out, you're trying to take bad things out that have been added to the environment, and you're trying to keep good things in. So bad things out, we don't want a lot of pollen coming to the building. If your building is in a polluted area, we don't want that pollution coming into the building. That's why as you bring in outside air, usually the first thing that happens is it goes through a series of filters to keep the bad things out. Now, taking bad things out, any contaminants that are generated in the space, so those sneezes that we were seeing a second ago, that's a contaminant that's added into the space. You want to get that back out of the space and dilute it so that it can't be an issue. And then keeping good things in, you spend a lot of money heating and cooling your buildings. You don't want to exhaust all of that treated air right out the door. So the goal is to keep air quality as good as possible while also minimizing cost. So here's a few practices that you can adopt for addressing indoor air quality, and I'm going to go through them in more detail. So for ventilation, strongly recommend just doing a quick Google search for CDC ventilation, because they put together a really good guide of all the things you can do. It's a really good resource for kind of just top to bottom. What are some inexpensive things you can do? What are some things you can install? Things like that. But discussing them in a little bit, you can start by opening the outdoor air dampers beyond their minimum settings, especially if you have mild weather. So again, if it's really hot, really cold, you don't want to be bringing in entirely outside air and heating and cooling that. So you're probably going to be recirculating some of that air. But if you do have pleasant weather, as a lot of us are heading into right now, that will let you bring in as much outside air without dramatically impacting the cost of doing so. If, again, with mild weather, if you can open windows and it's easy to do so, that's definitely something you can consider. You can even install fans in those windows to exhaust air out. That will increase the amount of air flowing into the building and prevent air from recirculating within the building or becoming stagnant. And then one of the new recommendations is leaving your HVAC system's fans on 24/7. So instead of doing what's called demand control, setting your building so as people show up in the morning and they leave in the evening, and you dial the HVAC up and down for that, just leave it on. Keep that air going through the filters and everything like that can be beneficial. And then do remember, as you're doing all this, that you do want to keep bad things out. So again, if you have pollution, if you know the algae season's getting really bad, cottonwood trees are going crazy, don't bring in as much outside air, but if you can bring in as much outside air as possible, it's definitely worth doing so. So let's talk about filtration a little bit. So filtration, filters are all on a MERV rating, so that's the minimum efficiency reporting value. Basically, it's just a measurement of how effective they are at keeping particles from coming into your building. So the higher the number, the more they're able to filter out and prevent from coming into the building. The issue there is that you definitely want to go to as high a number as possible, but you don't want to put too much strain onto your system. So I've got a 2-year-old daughter who loves playing with Play-Doh. She could play with Play-Doh 24/7 if we let her. She has a little contraption that lets you push the Play-Doh kind of through a screen to make noodles, strings, things like that. The smaller the hole, the harder it is to push that Play-Doh through. And I'm sure eventually, if we made some grid with really teeny tiny little holes, it could get to the point where neither she or I, although she's probably stronger than I am, could push the Play-Doh through. Filters and air, really similar concept. The smaller the holes that the air has to go through and the thicker the material, the higher that MERV rating, the more your system is working to push the air through that. It's a concept called static pressure. If your system has to work too hard, eventually that will cause wear and tear on your system, which can be detrimental as well, of course. So the goal here is to filter out or figure out how high of a MERV rating your system can handle and then get that installed. Now, direct supply can help with this. We can work with you to understand what your systems are right now, what MERV rating you're currently using, what MERV rating we think you could safely go into without negatively impacting your system, and then we can help you make those changes to your system. There's even an option to install a thicker filter rack. So many people are using 1-inch filter racks. You can upgrade to a 2-inch filter rack. What that does is increases the surface area that you're pushing through. So going back to that Play-Doh analogy that my daughter was playing through, if she's pushing the Play-Doh through a hole this big, and all of a sudden we make the hole this big, it's just that much easier to get it through. So you're able to get to a higher level MERV rating without having as much of a negative effect on your system. The other thing I'd love to talk about is augmenting your system with technologies like UV or ionization. We've found that installing needlepoint bipolar ionization can be effective, and I'll discuss that in a little bit more detail in a second here. Either UV ionization, these are both things that you can install into your HVAC system, maybe install into PTACs. There's some technologies out there for that now to enhance ventilation and enhance filtration beyond what you're currently able to do. Last thing I wanted to talk about before we getting into the details of ionization are portable air filters. So you've probably heard of HEPA filters. That's an even higher quality filter than MERV ratings technically they overlap, but if you put a HEPA filter in your typical HVAC system, it would be too thick. It would put too much wear and tear on your system. So what's far more common is putting them in portable air filters. And those you can just take to anywhere that you know you have an air quality concern, or you know it doesn't get hardly any ventilation at all. So installing a portable air filter, the things you want to look for there is they all will describe what the clean air delivery rate is, and that's essentially the square footage of an area that they're able to service. So you just want to match the portable air filter to the space that you need it for. You can put multiple units into a larger space if that's what you have. The other issue that you kind of have to balance for is the volume levels of them. But it's a great way of dramatically improving the air quality in a space that's not being well serviced by your overall HVAC system. So getting into ionization a little bit more, and I'm actually going to use this slide too to discuss some of the technologies that we were just talking about. Needlepoint bipolar ionization treats the air throughout your building. It emits positive and negative ions into the airstream, and then puts them through your HVAC system and out into the occupied space. So this is where the ionization would get installed. It goes after the filters and before the coils. Just kind of running you through this diagram because it's a good kind of recap of everything else we were just talking about. Larger HVAC systems will have a damper right here, so you can control the mix of outside air coming in versus the return air that's being recirculated. So that would go through the filters. MERV 13 is what you should try to get to if you can, if your systems allow for that. Otherwise, like I said before, we'll work with you to identify what's the highest you can get to. And then the ionization gets added into the air, and then it goes through the rest of the HVAC system and then out into the ductwork, and then from the ductwork out into the occupied space. So NPBI helps air quality multiple ways. It will inactivate pathogens directly. It'll help break apart odors. It'll also help smaller particles clump together and then either fall out of the air or get filtered out of the air. So it's addressing all of the key concerns of air quality, which is one of the reasons we like it. It's been especially important over the pandemic, and we think it will be just as important for future, hopefully not pandemics, but at least, the flu season, things like that. It has proven results against coronavirus. The first piece of this were lab studies that were conducted in the summer and fall. And what these do is show that the ionization is able to inactivate the pathogen and actually prevent it from being infectious. It's on par with killing it. What that does is it shows that it's able to reduce the amount of virus that's in the air, and the logic from there being that if you're inhaling less virus, you're less likely to become infected. So that's the lab results. Recently, we were able to look at all the buildings where we've installed ionization over the course of the pandemic. So we took our database of where we've installed this technology, we compared it to data that the CDC has been collecting on the cases in every building every week over the course of the pandemic. And what we found is that if you were a resident in a building that had this technology, the needlepoint bipolar ionization, installed in both common areas and resident rooms, you were there was a 41% reduction in risk of being infected by COVID. So you're less likely to be infected in COVID if you were in a building where this technology was installed. So that's a great real-world example of how this technology works and made a difference for our customers that installed it over the course of the pandemic. So we've started seeing, and John mentioned this a minute ago, more funding for air quality improvements. We've been keeping an eye out for this so we can keep our customers informed. We recommend that you keep an eye out for it as well. If your state or another local organization or even at the federal level provides any funding for indoor air quality, we can work with you to identify what the best solutions for your particular building would be. We can put together an estimate for you, actually get the work installed on time. And many of these have a pretty tight deadline of you need to apply for the funding, get it installed, have your invoices, and then get the grant funding back to you. So we're happy to work with you through that entire process, and we've had a lot of success with this in a few states thus far. The last thing here before we dive into questions, we've, and John mentioned this before, residents want to not just be safer, they want to feel safer, they want to see that it's been demonstrated. And as John mentioned, that's especially hard to do with something as invisible as indoor air quality. You could put the best filters into your system in the world, and visually, no one is going to be able to see the difference. They're going to be safer, they're going to have better air quality, they're going to be more comfortable, but they're not going to be able to see that. So we've worked on a package of materials to help you tell this story. Decals and stickers that you can put in your window to inform people of how you're keeping them safe as they enter the building. We've got communication templates ready for you to share with residents, staff, visitors, social media copies so you can tell the story to the world, brand guidelines, and more. We're also happy to help with things like this webinar. We've done that for some customers. Any way that we can work with you to help tell this story, we're happy to do so. We think this technology in improving air quality is critical to helping both with the current pandemic and future pandemics and influenza. And we want to be part of this story for you and your customers and help you on this journey. So there's a few ways you can learn more. We'll make sure these links get shared with everyone that joined today. And then you can send us questions about funding, the link you see here. That's pretty much it for our presentation. We're happy to go in more detail with any questions that you have for about probably 10-15 minutes here.
Wow, that was such a great presentation. So thank you both for all of that expertise that you shared with us. We did have some questions come through. Let's start with this one. Do you have any information on what funding is available to senior living for improving air quality?
Sure, I'll snag that real quickly. Direct Supply, as I mentioned, is really engaged with working at the federal level, obviously, trying to figure out how to secure infrastructure modernization dollars as part of the infrastructure package. There's a lot of work to be done there. Perhaps of more relevance in the short term, we're also working with all the state healthcare associations. So that second link that Zane had up on the screen is going to be your best bet, because this is a moving target. Some states had programs available. Others are right now in the process of appropriating CARES Act funding. Many states got billions of dollars. X number of millions are going to be appropriated by the governors for indoor air quality, we think. And as that changes, you can go to that link and keep in touch with your Direct Supply contacts, because we have a team of people tracking that to make sure that all the senior living operators get to take advantage of those funds. I think it speaks to the importance of knowing your game plan now, though, and doing an assessment of what your buildings may need, because once funds may be available for some of the buildings that you operate, you want to be able to pounce and make sure that you invest in the right stuff.
Excellent. Zane, I think this next one would be best for your expertise here. How do the latest changes in our CDC guidance impact the best thinking around indoor air quality? More specifically, that the primary method of transmission of COVID was from aerosolized particles.
Yeah, so the research is pretty clear now that airborne transmission is the primary way that COVID has been transmitted. I'm sure we all remember being super worried about surfaces earlier in the pandemic, but airborne and droplet transmission is really the primary route. Droplet is why we have things like the 6-foot rule, things like masks help with droplet transmission. So that's, that photo of a sneeze that we showed earlier, where you can see the droplets go into the air. That's what's being addressed there. Airborne transmission kind of has a technical definition, kind of referring to any smaller particles going over a longer distance. But really what we know at this point are the, indoors is less safe than outdoors. A more crowded environment is less safe than a sparser environment. It's the ability of the virus to accumulate in the air and then be inhaled by someone else. So the current CDC guidance, and again, I recommend Googling just CDC ventilation and going through all their best practices. It's really focused on what are the quick, easy, or even more intense things you can do to improve ventilation as much as possible. And that really is all addressed on this idea of this being a primarily airborne or aerosolized virus that can spread, person to person via the air, and everything we can do to dilute it. Everything related to indoor air quality is about diluting contaminants in the space. So more outside air means that you're getting more fresh air into the space and reducing the amount of contaminant in the space. Filtration means that you're taking the air through the system, filtering out any contaminants that might be in it. Things like ionization are about either directly attacking the pathogens that are in the space, or again, helping the filters perform even better as the air recirculates. UV, kind of similar, as the air recirculates through the system, it's trying to inactivate and attack the pathogen as it goes through. Everything is about trying to dilute the amount of virus in the air so that you're less likely to inhale enough of it to become infected.
Excellent. I'm going to pick on you right away again, because I think you're going to be best suited to answer this one as well. So do you have any suggestions around what the best indoor air quality system might be to add to an existing HVAC system?
So we like saying that there's no silver bullet. And the way the CDC puts it is that you need to take a multi-layered approach. So it's really, you should try doing all of these things. And then especially for different use cases, different situations that you might have, look for the best technology possible for the particular situation that you're in. Everyone should be looking at how to increase ventilation. Everyone should be looking at how to improve their filtration up to MERV 13 if you're able to get there. Technologies like ionization, UV, really, really good additions into your system, especially if you can't increase the ventilation or filtration as much as you would like, which is common in especially a lot of senior living buildings. And then portable air purifiers are the one that probably has really particular use cases to consider. If you know there's a resident room that just gets no ventilation, the HVAC system treating it isn't doing much, or there's a PTAC in that room that can't do anything for moving the air around, that's where you want to consider something like a portable air filter. Or there's even newer technologies now you can add directly into a PTAC, like UV or ionization, to at least make the PTAC doing more than it would be otherwise. But there's really, again, no silver bullet. You definitely want a multi-layered approach, and imagine kind of stacking them on top of each other to make it as effective as possible.
Excellent. Thank you so much. So Zane, you did touch on this earlier during the presentation, but could you address specifically what are some of the best things to do to maintain good quality of air inside resident rooms specifically?
Yeah, so I touched on a little bit of this. A lot of resident rooms, in our experience, are treated by PTAC. So it's a PTAC that's doing the heating and cooling in that space. If you're not familiar with PTACs, it's, the vast majority of hotel rooms are using the same kind of units, that bigger wall-mounted heating and air conditioning unit that everyone's familiar with. Those traditionally just have a real simple dust filter. They don't do much. They certainly don't do much to improve air quality or fight pathogens. They are a little filter you can pull in and out and wash. It's just not a great system for improving air quality. It's further exacerbated by the fact that most PTACs aren't doing anything to bring in fresh outdoor air. So you can do things as simple as open windows if you can. If the air outside is fairly clean and pleasant, opening windows is certainly advantageous. If your HVAC system treats that area, definitely make sure you're having good filters treating the area. And then we are starting to see ionization products that you can put into PTACs that will enhance especially the ability to fight pathogens, but they'll also help even that filter get a little bit more out than it would be able to otherwise. And then we are seeing some companies introducing UV technology. So as the air is recirculated, because a lot of air is recirculated in the PTAC, it'll go past a UV lamp. And what UV lights do is they emit a really specific band of UV light that will break apart the DNA in any pathogens or other contaminants that are going by it. So it's a way of removing pathogens as the air recirculates. So those are all good systems. And again, portable air filters are always kind of the best backup if you either don't know what you can do or want to take a more aggressive step. HEPA filters are phenomenal. They have very proven results against pathogens, and they're usually a pretty economical addition to a room, especially something the size of a resident room.
Excellent. Okay, a few more here. John, I promise I'm coming for you, but Zane, I think this one's right back in your wheelhouse. Are there any reasons why someone wouldn't upgrade to a MERV 13 system?
Yeah, so again, using that Play-Doh analogy, if you're trying to push the Play-Doh through something with holes that are too small, it's going to be very hard to do. With air and filters, the tighter the weave in the filter, the higher the MERV rating. It's way more effective for filtering things out, including pathogens, but your system's going to need to work a lot harder to shove that air through that filter. So your system should be examined, and the history of maintenance should be kept in mind. If it's an older system, if it's a system that you know might have some issues, you're just going to increase the wear and tear in the system, and you're going to increase the likelihood that it's going to fail sooner than it would otherwise. That's where you want to figure out how high you can go. If it's a newer system, or you know for a fact that the system was specifically designed with that level of filtration in mind, go ahead. You should definitely be putting in MERV 13 or even higher filters if you can, because you're going to get even greater benefits both for improving air quality from an odor and particles perspective, as well as fighting pathogens.
Excellent. All right, John, I said I was going to come for you with this one. Will senior living operators be able to reduce the amount they spend on cleaning supplies if they increase what they are spending on that indoor air quality?
Well, I mean, I think we hope so. I think Zane said it right when he said there's no silver bullet. What has happened is that I think the infection prevention narrative has evolved in senior living, and we spent billions of dollars on cleaning surfaces, and that will continue to be a really important part of infection prevention, I think. But I also think, as we look at what happened with COVID, what we've now learned, it was a disproportionate investment in cleaning stuff and not thinking about indoor air quality. And easy to say now, we've got all this data. So I think moving forward, we have to look at indoor air quality as an equal part of the infection prevention equation, and make sure that what we do for the air is complementing what we're doing for surfaces. And while doing so, I think if we're smart, we can reduce the amount of money we spend on all things. We can reduce energy costs, we can reduce cleaning supply costs, we can reduce filter costs. I think there are ways to make that reality come true, but we have to be smart and have a very deliberate plan based on every unique building's needs. So I think the answer is let's hope, and I think we all have to implement some smart strategies to make that so.
Excellent. Okay, so there is one more question, and I think I'm actually going to take this one. So we had a question come through asking if this presentation will be available at a later time or for sharing with others. And the answer to that question is yes. So everyone who was invited to this event received a landing page. That is where you logged in to view this event today. The recording will stay live and available for viewing on that landing page, but it will also be turned into a variety of blogs and articles and available resources on our Insights page as well. So that's everything that we've got for you today. Thank you all for such great questions. An extra big thank you to John and Zane for their expertise and their time today. If you do have any questions about what we discussed today, you can feel free to email us at webinars@directsupply.com. That's webinars@directsupply.com. Or you can feel free to place any lingering questions into the form on this page that you've joined. That wraps up everything we've got for you. Thanks again for joining us today, and enjoy the rest of your afternoon.